covers New Hampshire like we do. We're WMUR News 9.
In Living Well, it's a disorder affecting millions of people, many of them children. Attention Deficit Hyperactivity Disorder, ADHD, is a complex, challenging ailment, and it's often difficult to diagnose and treat.
Jennifer Vaughn takes us to a New England clinic offering hope and some solutions to even the most challenging cases.
Right? So you
This is Quinn, 9 years old and already planning his dream job.
I want to be a cartoonist, make one-of-a-kind clay figures, and make puppets.
Quinn and his parents all have various symptoms of attention deficit hyperactivity disorder. That's why they travel from their Hudson home to this North Andover, Massachusetts practice and its unique family-based approach to treating them.
It's very cohesive, and I like the idea that it's in-house where you're dealing with all the same people that are right there. You're not going to have that telephone where one person says this and has to go and tell him this and that. Well, I forgot to tell him that. It's right here. They talk with each other.
Dr. Cerulli first gets to know all facets of the patient. In this case, learning about Quinn and what his parents were noticing.
He couldn't go from one to another, one subject to another. He'd start getting bored, and then it was just like, forget it, He's supposed to do 3 subjects in a day, or he'd get 1 maybe.
It's not just a checklist approach, which I call a cookbook approach to the diagnosis, but really sitting down and doing a thorough evaluation of testing from a specialist that's all they do all day long.
Unlike many doctors who treat these disorders as part of a larger practice, here, this is all they do, with custom-designed programs to help each patient reach maximum potential once the true problem is uncovered.
Depression, anxiety, tic disorders, bipolar, sleep disorders. Not only can those all look like ADHD, they can coexist with ADHD. And that's where the specialty practice like this really makes a difference. It's getting the diagnosis right from the very beginning.
ADHD is both underdiagnosed and misdiagnosed, so doling out medication can be complicated.
I'm not here to bash medications. I very much support what good medicine can do, but it just cannot be without the support of a counselor, a coach, nutrition. We spend a lot of time looking at nutrition.
Families also learn ways to organize their lives around ADHD, what little things work in the classroom or on the job, finding the best ways to help themselves and their children.
ADHD is one of those areas when addressed properly, when the time and effort is put in, we can make such a difference as clinicians. And families, I've had some families in tears saying, why didn't I do this sooner?
All patients are welcome at the ADD Health and Wellness Center, but insurance typically won't cover the services, which can run several thousands of dollars. If you'd like some more information, you can check WMUR.com and click on Health. For Living Well, I'm Jennifer Vaughn.